Okay, so how old does my child need to be to self-carry an epinephrine autoinjector or asthma inhaler at school? So this is a question that I get asked a lot. I'm sure Mike does as well. And, there's no clear-cut black and white answer, unfortunately. I think that it's important that if your child can actually demonstrate proper use while you're at the physician appointment, that would be essential, because that would be an opportunity to correct any type of improper technique or address questions and things like that. And if they're not able to appropriately demonstrate proper use with a training device in a non-threatening environment like at a physician's office when they're feeling well, then we wouldn't be able to expect them to, use the device appropriately in an emergency situation. So I think that's number one. I always ask my patients if they can actually show me how to do it, and if they can, then I'll clear them to carry it themselves. I think a lot of my colleagues would say that there's no cutoff, because developmentally, both mentally and even physically, just to handle the devices, there's a huge range amongst children. I would say ballpark figure, wouldn't start thinking about this till kids are at least 9 years old, but usually it's going to range from anywhere from 9 to 13 years of age before you start considering this. So once your child's around that age, or starting to think about 4th grade, 5th grade, 6th grade, things like that, then you can start to address it. But one thing I strongly recommend is if they can demonstrate to their healthcare provider and they use it appropriately, then that would be sort of a checklist before thinking about this. Any thoughts on that, Mike?
Yeah, a couple things to throw in there is that there is a slight difference between self-carry and self-administer. In some schools, because of the setup, because of the resources, they do have children self-carry, but without the expectation that they would self-administer. Now, this is sometimes something that some families request, so a kiddo would travel around the school, if that's the way things work in their school day, with potentially a fanny pack or some sort of bag that goes with them. There's upsides and there's downsides. Some kids and families this does not work out for. Some families actually feel a little bit of relief that they know that there is an autoinjector that's available. Some of the things that can be challenging would be if it's forgotten, if it's lost. It should not be the only autoinjector for that child. There should be another one that's available and managed by a school staff member. And then as far as self-administration, where somebody would be expected to self-administer, this is going to be something where in any circumstance in a school, there should be a staff member who is going to ultimately be responsible to be able to recognize and treat anaphylaxis. So even if there's a child who self-carries and is able to self-administer, that should not be the bottom line. Ultimately, a staff member should be able to have access to auto-injector, and not only the one that's on the child, and should be able to recognize and treat anaphylaxis. And so if you hear from a school that because your child has been deemed okay to self-administer, just make sure that that doesn't mean they're the only person who now can. And then things to think about also are that when our children are expected to be by themselves, when they're going to be taking the bus by themselves, staying at the bus stop, going to their friend's house, hanging out there, if there isn't an adult, then we really do need to train them to be able to recognize and self-administer. And perhaps we'll need to come up with alternative plans if we feel that they're developmentally not ready for that. If they can't demonstrate it, then they really shouldn't be alone.